Finally, as promised, a special comment on the latest version of H.R. 3590, the Senate health care reform bill. To again quote Churchill after Munich, as I did 6 nights ago on this program, I will begin by saying the most unpopular and most unwelcome thing, that we have sustained a total and unmitigated defeat without a war. Last night on this program, Howard Dean said that with the appeasement of Mr. Lieberman of Connecticut by the abandonment of the Medicare buy-in, he could no longer support H.R. 3590. Dr. Dean's argument is informed, cogent, heartbreaking, and unanswerable. Seeking the least common denominator, Senator Reid has found it, especially the least part. This is not health, this is not care, this is certainly not reform. I bless the Sherrod Browns and Ron Wydens and Jay Rockefellers and Sheldon Whitehouses and Anthony Wieners and all the others who have fought for real reform, and I bleed for the pain inflicted upon them and their hopes. They have done their jobs, they have served their nation, but through circumstances beyond their control, they are now seeking to reanimate a corpse killed by the Republicans and by a political game played in the Senate and in the White House by men and women who have now proved themselves poorly equipped for that fight. The men of the current moment have lost to the mice of history. They must now not make the defeat worse by passing a hollow shell of a bill just for the sake of a big stage signing ceremony. This bill, slowly bled to death by the political equivalent of the leeches that were once thought state-of-the-art medicine, is now little more than a series of microscopically minor tweaks of a system which is the real-life, here-and-now version of the malarkey of the town haulers. The American insurance cartel is the death panel, and this Senate bill does nothing to destroy it, nor even to satiate it. It merely decrees that our underprivileged, our sick, our elderly, our middle class can be fed into it as human sacrifices to the great maw of corporate voraciousness at a profit per victim of 10 cents on the dollar instead of the current 20. Even before the support columns of reform were knocked down one by one with the kind of passive defense that would embarrass a touch football player, single payer, the public option, the Medicare buy-in, before they vanished, the Congressional Budget Office estimated that the part of the bill that would require you to buy insurance unless you could prove you could not afford it would cost a family of 4 with a household income of $54,000 a year, 17% of that income, $9,000 a year, just for the insurance. That was with a public option. That was with some kind of check on the insurance companies. That was before, as Howard Dean pointed out, the revelation that the cartel will still be able to charge older people more than others, will at the least now be able to charge much more, maybe 50% more, for people with pre-existing conditions. Pre-existing conditions, you know, like being alive. You have just agreed to purchase a product. If you do not, you will be breaking the law and subject to a fine. You have no control over how much you will pay for that product. The government will have virtually no control over how much the company will charge for that product. The product is designed like the Monty Python sketch about the insurance company's never pay policy, which, you know, if you never claim is very worthwhile. But you had to claim, and, well, there it is. And who do we have to blame for this? Well, there are enough villains to go around. Men and women who, in a just world, would be the next to get sick and have to sell their homes or their memories or their futures just to keep themselves alive, just to keep their children alive against the implacable enemy of American society, the insurance cartel. Mr. Grassley of Iowa has lied and fomented panic and fear. Mr. DeMint of South Carolina has forgotten he represents people and not just a political party. Mr. Baucus of Montana has operated as a virtual agent for the industry he is charged with regulating. Mr. Nelson of Nebraska has not only derailed reform, he has tried to exploit it to overturn a Supreme Court decision that is, in this context, frankly, none of his goddamned business. They say they have done what they have done for the most important, the most fiscally prudent, the most gloriously phrased, the most inescapable of reasons, but mostly they have done it for the money. Lots and lots of money from the insurance companies and the pharmacological companies and the other healthcare companies who have slowly, deliberately, and effectively taken this country over. Which brings us to Mr. Lieberman of Connecticut, the one man at the center of this farcical perversion of what a government is supposed to be. Out of pique, out of revenge, out of betrayal of his earlier, wiser, saner self, he has sold untold hundreds of thousands of us into pain and fear and privation and slavery for money. He has been bought and sold by the insurance lobby. He has become a senatorial prostitute. And sadly, the President of the United States has not provided the leadership his office demands. He has badly misjudged the country's mood at all ends of the spectrum. There is no middle to coalesce here, sir. There are only the uninformed, the bought off, and the vast suffering majority for whom the urgency of now is a call from a collection agency or a threat of rescission of policy or a warning of expiration of services. Sir, your hands-off approach, while nobly intended and perhaps yet someday applicable to the reality of an improved version of our nation, enabled the national humiliation that was the town halls and the insufferable Neanderthalian stupidity of Congressman Wilson and the street walking of Mr. Lieberman.